kind of officially start?
Okay, it started.
Welcome to the Holistic Kid Show. My name is Zane.
My name's Yuan. And my name's Gossam.
We're the Holistic Kids here to educate us kids from the inside out. We know us kids from the inside out. We know us kids are getting sicker, specifically autoimmune disease. Prevalence doubled from 10.4% in 2010 to 20.8% in 2018.
What's an autoimmune disease?
When your body's attacking itself.
Autoimmune diseases can affect the body and the brain. What? The brain too?
Yes, and this is why we need to speak to Dr. Zendi about kids that affect a lot of kids, but most people of doctors don't talk about it. Dr. Zendi Moldenhauer, PhD, NPP, PNP, RN, VC, IFMCP, is the founder and chief medical officer of Arbor Health, Functional Medicine and
Psychiatry
in Rochester, NY, and nationally recognized leader in pediatric functional psychiatry. Dr. Zendi brings over 25 years of clinical experience and a deep commitment to transforming how we understand and treating complex neuroimmune and mental health conditions.
She holds a PhD in nursing from the University of Rochester with a specialization of adolescent mental health and a board certified as both a psychiatric nurse practitioner and a pediatric nurse practitioner. In addition, she is a board certified in functional medicine through the Institute of Functional Medicine, IFM, and has pursued advanced training in holistic training, IIN, integrative psychiatry, IMMH, neuroimmune disorders in China.
Children. And tick-borne infections and Lyme disease, ILADS. Dr. Zendi is best known for her pioneering work in PANS, PANS, and PANDAS, not the animal, PANDAS, where she takes a root cause approach to uncovering the biological and environmental triggers such as Lyme disease, mold, and gut-brain imbalances that drive chronic neuroinflammation. Her integrative and compassionate model of care has helped countless of children and families find clarity, healing, and hope.
Wow, thank you so much for joining us today.
Thank you so much for having me. I appreciate the invitation.
We would love to know how you started helping kids with their mental health.
Thank you for the question. I have always known that I want to work with kids, even since I was little myself, and I always wanted to be a children's nurse. So I became a pediatric nurse practitioner originally, but then I was so struck by the fact that so many kids have mental health concerns like anxiety or depression or ADHD, as well as issues with their body like headaches or tummy aches or fatigue. And so I was so interested in understanding both the body as well as the mind. So that's why I became a psychiatric nurse practitioner as well. And so I put those two things together, and it's so cool to understand how the body affects the brain and how the brain affects the body, and combining that can really help kids.
Wow, that is amazing how you did that, and now you're helping kids all around.
Yeah,
like with their mental health, like all around.
Mm-hmm. Yeah, absolutely.
So when we were mentioning PANS and PANDAS, a lot of people probably thought the animal. But we're talking about the autoimmune condition. So can you please explain what PANS and PANDAS are?
Absolutely. So
to kids our age.
Sure. So PANS, PANS, stands for pediatric acute onset neuropsychiatric syndrome. And PANDAS, PANDAS, stands for pediatric, autoimmune, neuropsychiatric disorders associated with strep infections. So those are big words. What it really means is that they are conditions that affect the brain and the body, and it's often triggered by infections. And it can show up quite suddenly. It can happen over several weeks or months, but it can also happen fairly quickly, like overnight or over a few days. So that's why it can be really concerning to kids. And then suddenly kids can have more anxiety, changes in their behavior, even changes in their movement, like tics, like motor tics. So basically, it's like, imagine if you woke up one day and your brain started playing tricks on you, giving you worried thoughts that you can't stop, making your body move in ways that you can't tell it to stop, creating really big feelings that are too hard to handle. Well, that's what happens with kids having PANS and PANDAS. And the tricky part is you can't actually see it. It's not like you have a broken arm and then everybody can see you have a cast. This is what's going on inside. So it can be really hard for kids and their families. It can be confusing. It can be scary for them as well as their families. Because what really happens is that the body is supposed to protect us with our immune system, right?
Yeah.
And so if we get an infection like strep, for example, our body makes antibodies to fight that infection. But in some kids, that immune system gets confused and it crosses over the blood-brain barrier into the brain and starts attacking brain tissue called the basal ganglia. And that basal ganglia is really what helps to control behavior or mood or movement. And that's why we call it an autoimmune disease, because the immune system kind of glitches, if you will. It's nearly like the computer system just starts glitching and it starts attacking itself when it shouldn't. It should be just attacking the infection.
Wow.
Yeah, because a lot of kids, I mean, you don't really hear a lot about PANS and PANDAS, so I guess it's really important that we're talking about it today.
Absolutely, because you know that it exists in at least 1 in 200 children. And I think that's even a low number. I think it's way more than that. But 1 in 200 children are diagnosed with PANS or PANDAS.
Oh, that's actually a lot a lot more than what should be, happening. So we need to
Right.
really fix this.
Yeah, like according to like the other ones, like if it's probably just gonna keep getting worse until we have to do this.
Mhm.
Like I don't know about the really studies right now, but like I know it's bad.
Mhm. So a lot of the kids right now may not know if they have PANS or PANDAS. So what are some symptoms that people might have to maybe look out for their PANDAS or PANS? Like
Right.
some maybe signs.
Well, one of the biggest signs is anxiety, but anxiety that kind of happens, not just a mild anxiety about lots of things. The anxiety is really intense, often with something that's called OCD or obsessive compulsive disease, which means that kids start thinking things over and over and over and over, or they get intrusive thoughts where thoughts push into their brain that they don't even want, but that keeps pushing into their brain. Or kids feel like they have to do something in a particular way, like touch the light switch a certain number of times, or touch a doorknob a certain number of times. Or kids might feel like there's something wrong with the food that they eat. And so they can get super, super picky about eating in a way that's kind of like scared of eating, because again, it's that anxiety playing tricks on kids. It can also affect movement. So sometimes kids can get like a little muscular tic or some movement to their body. It can also affect how their brain works in terms of being able to do schoolwork and focus and concentrate. Interestingly enough, kids' handwriting can suddenly become super messy. Like kids who can spell well and write well can suddenly struggle with their math facts or with spelling or their handwriting. Some kids can struggle at nighttime with bad dreams, or even like wetting the bed, and it's not their fault. It's just what's happening to the brain. The brain is inflamed, or nearly like the brain is on fire with this autoimmune reaction to the infection, and then the brain is nearly like glitchy. And you can imagine that must be really confusing and really scary, especially when the symptoms can come on really quickly and parents don't know what to do and kids don't know what to do. So I'm so glad that we're speaking about this, because I really want more families to know about PANS and PANDAS so that they can recognize it. So especially when mental health concerns come on really quickly, that's when to pay attention, to try and figure out the root cause, or like what's going on underneath, to explain what is happening in the brain.
What's it like for a kid when they suddenly start doing things they can't control?
I imagine that it could feel really weird and scary. Like, imagine if your hands suddenly start tapping, or your eyes started blinking a lot, or you couldn't make it stop. Or what if you suddenly felt like you had to wash your hands over and over again, even though you knew they were clean? So it's nearly like the brain is telling you things that are not true, like something bad will happen if you don't check the door 5 times. And the tricky part is, part of you knows that this is not real, but the brain kind of plays tricks on you. So I think kids can feel really confused, maybe even angry, maybe scared, and worried about what's going on.
How does having a brother or a sister with PANS/PANDAS affect other kids in the family? Like, is it contagious or?
That's a great question. PANDAS is not contagious. I mean, we all can get kind of strep from each other, but not everybody that gets strep gets PANS or PANDAS. So it's not contagious, but I bet you that lots of siblings can feel afraid that they might catch PANS or PANDAS from their brother or sister. And I think it can be really confusing for brothers and sisters to know what's going on and how they can help their sibling. They can also feel scared or confused. I also think that I wonder if some siblings can even feel a little jealous if the kid that has PANS gets a lot of focus and a lot of attention by mom or dad, because they're trying to help that kid. And some kids might feel a little bit left out, or like the attention is not on them. I think some siblings might even feel a lot embarrassed when they are out and about, like at school, and the sibling with PANS, PANDAS is saying or doing things that seem weird, even though they can't help it. So I think siblings could sometimes feel a little shy around them. And I think that's when families really have to pull together to understand what PANS, PANDAS is, know that there's treatments for PANS, PANDAS, and figure out how they can help each other.
Wow, that is amazing. And it's so cool that you look through different perspectives. And that's really important because there are many different perspectives.
Yeah.
Right.
So when going through PANS/PANDAS,
Yeah.
do we mean like, are they the same or are they different? Like, what's the difference?
Okay. So the original definition was PANDAS because in the 1980s, Dr. Susan Sweeter at the National Institutes of Health was one of the first doctors to name this condition. And that's where the word PANDAS was developed. And the studies were all about the change in response to strep. So PANDAS is always associated with strep. You know how when you might have been to a doctor with a sore throat and they do a strep culture and they say you're positive for strep? That's the germ that I'm speaking about. But remember, not everybody that gets strep gets PANDAS. This is just the autoimmune response to that infection. PANS can be from any other autoimmune trigger. So it could be from Coxsackie virus, walking pneumonia called mycoplasma. It could be from Lyme disease. It could be from mold illness. So PANS can be from a lot of different triggers, but how the person acts is pretty similar. It's just, is it from strep or is it from other things?
What are some helpful things kids with PANS/PANDAS can do when they're having a tough day?
Oh, I think there's so many things that kids can do that might help. And there can be lots of little things like moving the body, like swimming or riding a bicycle, jumping on a trampoline, can help burn off a lot of anxious energy. I think lots of kids love to play with fidgets like a squeeze ball or squeezing a pillow or using fidget toys or even wrapping themselves up in a weighted blanket to feel safe. I think taking deep, slow breaths is like a superpower for the nervous system because taking deep, slow breaths can help tell your body you're safe, you're not in danger. So I think it's like a secret weapon that kids can do in any situation, whether they're at school or whether they're at home, because it just helps the body say, it's okay, you're okay. I think it can be helpful to have a quiet space in the house or at school where the body and the brain can just rest, because it's really exhausting to have PANDAS. And so sometimes people just need a quiet space and a safe place to be able to calm down. There's also something called mindfulness, which means kind of paying attention to what's happening without any judgments, but just being in the moment. That can be super helpful. That could be like taking deep breaths or listening to music or spending time in nature or drawing, doing some kind of artwork or some kind of yoga. I think it's really important for kids to be able to speak with their parents, to share that they're having a hard day, and then to know that doctors and nurse practitioners and other practitioners can help them. Because everybody needs hope, right?
Yeah, everyone does need hope.
Yeah.
And especially because a lot of times maybe the kids don't feel safe.
Mhm.
Maybe these kids are getting bullied, or maybe they just feel scared all the time. So what are some things that parents can do to help their children feel safe?
I think parents can do a lot of things, and I think it's best to remember to be really patient and kind and believe kids when kids tell their parents how they're feeling, because it can be confusing, but the more kids can tell their parents, the more the parents can understand really what's happening. I think it's really important for parents to stay calm when emotions get intense. Kids with PANDAS can have very strong emotions and very strong behaviors, and they really need people around them to stay super calm, to help them feel a little bit safer and not feel like they're being judged. I think it's important to remind kids that there's answers, that there's healing, and that parents are helping them with getting better. I think it's important for parents to speak to teachers, that their kids' teachers, to also explain what's going on and what seems to help calm them down and what things make it worse. Because kids are at school a lot, and I think it can be difficult being in school as well. So parents speaking to teachers to help kids at school, I think is important. I think it's also helpful to have routines like predictability, especially when kids feel so anxious. It's helpful to have routines and predictability. And then mostly, I think it's also important for parents to take care of themselves. So having a kid with PANS or PANDAS can be very challenging. And so it's also important for parents to do good self-care to take care of themselves.
What can parents do to understand when the PANDAS or PANS symptoms get worse? How can they recognize it?
I think whatever the symptoms are that that kid is experiencing can just be more. So some mild anxiety can be super intense. Some mild misbehavior can be like full-blown tantrums and feeling like rage. I think that kids can really struggle with eating, and so being super patient with that is helpful as well. So it's more like the intensity of things gets that much worse, and that's one way to recognize that this brain is really inflamed or like on fire, that needs kind of some help and some rest and some healing.
Can kids and PANS or PANDAS get better? What does healing look like?
Absolutely. And that's a message that I really want families to hear. Healing is absolutely possible. Some kids get better quickly, and some kids it takes quite a long time. The earlier the condition is recognized, the earlier the proper treatments happen, the easier it is to heal the brain. When kids have had PANS, PANDAS for a long time, then it can take a little longer to actually get better. But kids absolutely can get better. I like to think of it nearly like a triangle in terms of treatment. The first part of the triangle is trying to figure out the trigger, like what's causing this in the first place. Is it strep? Is it mold? Is it Lyme? So there's kind of being a medical detective with the family and with the child who has PANS or PANDAS to like figure it out. The second part of the triangle is this is an inflammatory condition. And so we've really got to treat inflammation. It could be as simple as taking Advil. Advil can be very helpful with inflammation. Other things could be like omega-3s or vitamin D. They can make a difference as well. And then the third part is treating that autoimmune response, is that response to attacking the own brain. And so we have medicines and we have treatments for all three parts of this triangle. And then kids get better. And so healing can look like having more good days, having less intensity about those strong feelings and emotions and behaviors, starting to feel like more yourself, starting to feel more comfortable in the world again, having those worries quieten down, not having those worries be so scary, just like feeling themselves again. And not being so quick to react to everything around them.
Wow, that's amazing. And it's so important that many different, like all different types of families, all different types of kids recognize that their PANS and their PANDAS can be treated and they can feel like themselves again.
Yes.
So why is it important to talk about mental health and brain inflammation, especially for kids and teens?
Well, if we don't talk about it, then kids who are experiencing these strong emotions or symptoms of PANS or PANDAS can be super confused and can feel very alone because they may not know how to talk about it. They might fear judgment from people that think that it's contagious or think they're being a rotten kid or think it's their fault. But mental health is just as important as physical health to speak about and to focus on. When the brain is struggling, it needs care, just like a broken bone needs care to help with healing. So talking about mental health, I think, is super important to spread awareness, as well as for folks to know that they're not alone and to know that there's hope to get better, and that kids are not broken, that they can heal, and that there is a path to feeling like themselves again.
That is
So-
amazing.
So, what are key tips that can help this condition and overall teen mental health?
Overall, I think figuring out what's going on in the first place, speaking about it as a family and with siblings, finding a doctor or nurse practitioner that knows about PANS and PANDAS that can help kids, and then employing or doing the right treatments, like figuring out the trigger and treating the infection, decreasing the inflammation and that brain on fire, and treating that autoimmune response of the body to the infection, and knowing that there's hope to get better.
Yes, because we all need to know about the hope that we can spread to so much families and have so much families learn and help their children.
Right.
So, just for all, because we've been talking a lot about kids, but just for everybody to know, is PANDAS and PANS only for kids, or is it also a condition for adults?
Great question. The formal, the definition of PANDAS, just because it was studied, and when studying a condition, you have to have kind of terms and conditions. The official definition is between 3 to 17. But PANS doesn't have an age. And so I have seen this condition in young adults and in adults as well. I don't think that it's just a pediatric thing. It looks a little different. It's maybe not quite as intense in adults as it is in kids, but we do see brain inflammation from infections and Lyme and mold in adults too. And we treat it in a similar way, that triangle that I spoke about. And adults can get better from it too.
That's amazing.
Amazing.
Amazing. Thank you so much, Dr. Zendi. We are so thankful for your time and wisdom today. Now let's bring out Dr. Zendi's key points.
1 in 200 children are diagnosed with PANS and PANDAS. One of the biggest signs is anxiety. That is really intense, like OCD. Kids start thinking about things over and over again, and it can also affect their movement, how their brain works. It affects their focus and concentration. Even their handwriting can become super sloppy. This is your brain on fire due to the autoimmune reaction. Most of the PANS/PANDAS can be triggered by an infection.
Mm-hmm.
It can be scary, but there is hope. Get your body moving. That will help to slow your anxiety. Get outside and play. Take deep, slow breaths. It can make your body feel safe. Mindfulness is key. Be in the moment. Spending time in nature, drawing, or yoga can all help. Set a routine. Self-care is key to take care of the whole family.
Yeah.
And also, kids can get better. You can have less intense feelings. You can start to feel like more yourself. You can start to become yourself again. There is so much hope. You are not broken. You can heal. And thank you, everyone, for tuning in. Until next time, I'm Zain Ansari.
I'm not.
And I'm Qasim.
Follow my family and I on social media, Holistic Mom and D, and stay tuned for our book, The Teen Health Revolution, releasing November 13th, 2025.
Yay. That's amazing.
And kids need to learn from other kids. Please download our podcast on iTunes and leave a review so other kids and families can benefit. We need to create a healthy future for all of us and the planet. Join us next week for another episode of the Holistic Kid Show. We're kids, I'm Prime Kids.
Thank you, everyone.
Thank you.